The clinician will be seated in the same clock positions as for all other periodontal instruments. Holding the periodontal probe in a modified pen grasp, establishing a secure fulcrum, and using either a wrist or digital activation with light pressure, the clinician will insert the probe's working end tip into the sulcus at the distal facial line angle of the tooth being examined, gently sliding the probe tip downward to meet the sulcus or pocket base, all the while keeping the side of the probe tip in contact with the tooth surface. The probe is to be positioned as parallel as possible to the mesial, distal, and facial lingual dimensions of the tooth. Keeping the side of the tip in contact with the tooth, the clinician will activate a series of short, bobbing up and down walking strokes, walking the tip towards the distal surface within the sulcus or the pocket. These walking strokes are close together, approximately 1 millimeter apart, and are to be constantly contacting the junctional epithelium. The clinician will continue to walk the probe across the distal surface until the upper portion of the probe touches the contact area of the adjacent tooth. At this point, the clinician will slightly tilt or slightly angle the probe so to allow the tip of the working end to reach beneath the contact area into the coal area. The clinician will observe the measurements as the probe is being walked along and record the deepest reading obtained from the distal line angle to the midline of the distal surface. Now the probe is removed and reinserted back at the distal facial line angle. The clinician will now make a series of tiny walking strokes, keeping the probe adapted and parallel within the sulcus or the pocket, moving in a forward mesial direction along the facial surface. All the while, the clinician will be observing the probe measurements and then recording the deepest reading from the distal line angle to the mesial line angle on the facial surface. Continuing to walk the probe across the mesial surface until the upper portion of the probe touches the contact area of the adjacent tooth. At this point, the clinician will slightly tilt or slightly angle the probe to extend the tip of the working end beneath the contact area into the coal area. Observe the measurements and record the deepest readings for the mesial line angle to the midline of the mesial surface of the tooth.